In other COVID news, Japan approves the Moderna and AstraZeneca vaccines, plus the Japanese government also decided to add Okinawa to areas under a COVID-19 state of emergency. Joining us is Dennis Liu of our EBC Japan Bureau. Dennis.
Good evening, Alma and CJ. Japan formally approved Moderna and AstraZeneca's COVID-19 vaccines on Friday, but the latter, the AstraZeneca, will not be used immediately because of lingering concern over very rare blood clots. 9 regions, including Tokyo, are already under a virus state of emergency, with the measure now being expanded to Okinawa in the south. Until now, only Pfizer-BioNTech was available in Japan after being approved in February, and so far just 2% of the country's 125 million residents are fully vaccinated. Only medical workers and the elderly are so far eligible for vaccines, with no time frame yet for expanding the rollout. 2 mass vaccination centers operated by the military will open next week in Tokyo and Osaka to administer the 2-shot Moderna vaccine. Initially to the over 65s, there is no timeline yet for use of AstraZeneca jab, which some countries have restricted or dropped from their vaccine campaigns over rare blood clot concerns. Even though experts say the benefits outweigh the risks, Moderna's chief executive told the Nikkei newspaper on Friday that it was considering manufacturing the vaccine in Asia, possibly in Japan. Meanwhile, the Japanese government's expert panel on the coronavirus today has approved a plan to add Okinawa to the list of prefectures where a state of emergency has been declared. Okinawa will be under state of emergency from Sunday through June 20th. The state of emergency currently covers 9 prefectures, including Tokyo and Osaka. The minister in charge of the coronavirus response, Nishimura Yasutoshi, noted that the number of new cases and hospital beds occupancy rates show that Okinawa needs tougher countermeasures. He also suggested calling for restaurants and bars to stop serving alcohol and asking tourists to refrain from visiting the prefecture. The minister in charge of the coronavirus response, Nishimura Yasutoshi, told a panel meeting on Friday that infections are spreading across Japan and the healthcare system is overstretched in some areas. This is the latest for now. Reporting from Tokyo, Japan, this is Dennis Liu. We live in interesting times.